So I had to delete my last video on American healthcare, but I wanted to make another video on the topic really quickly and add some additional thoughts that I have. I want to first explain my personal experience with the US healthcare system, look through all the numbers, and then provide my own personal analysis on American healthcare versus healthcare in other countries or other developed nations. So for me, I am technically self-employed. My work is that I'm an Uber driver. So I'm not making a bunch of money or anything. But anyways, being self-employed, my only option for insurance or healthcare is government insurance. I don't have my work provide any insurance for me. It's just not part of how it's done. In America, generally speaking, people get their insurance through work. However, in other countries, most people get their insurance directly through the government. So what makes that a bit different is that we have a system where our government pays for insurance as well as we but directly pay for insurance. I pulled up right here, it's fiscaldata.treasury.gov. Our government pays around about $1 trillion per year for both Medicare and health, which is Medicaid. And Medicare is essentially insurance for people over the age of 65. And Medicaid or health is basically covering all the people that don't have insurance through their work, like myself. So it's self-employed people, it's people that potentially can't be covered because they have pre-existing health conditions. It's just everybody that's not coverable through their work. And so I bring this all up to say that American insurance and the whole healthcare system is just a bit more complex than the way other places do it in the world. Most people just go through one place. We have so many different avenues in which we are spending our money, whether it be through our work or via taxes. There are just so many different ways that we are extracting our dollars to pay for healthcare. Now, why is it so important to have healthcare coverage in the United States? Well, I'll share my personal story. Last year, I was hospitalized for 4 to 5 days, and my total bill came up to be around $150,000. For 4 nights at the hospital, I was paying about 35K a night just to be there. And that's just to let you know that American healthcare is so expensive to the point where it basically will bankrupt you if you get into a bad situation and you're not covered. So that really begs the question, what is the incentive in American healthcare? Is American healthcare designed to keep you physically healthy, or is it designed to keep you financially sick? Because if they're a for-profit institution, which is what American healthcare system is, then wouldn't the goal actually be to get you sick and hospitalized? And that's not to say like people are intentionally trying to get you sick, but eventually people do get sick. And that's usually by getting old. So, point is, there will be a point in your life where you will get sick, you will be hospitalized, and you will be having to pay a bunch of money in order to be taken care of. But let's take a look at some numbers. So, right now, here in the United States, we pay around $14,885 per capita, which means like per US citizen. In Switzerland, which is the next highest country, they're paying about like 9,900. They're paying like $5,000 less for per person for healthcare coverage. So we are paying 5K more per person in our for-profit healthcare system than all of these not-for-profit healthcare systems run by their governments. If we run the numbers on that and we take our 340 million population times 5,000, that is $1.7 trillion transferred from the working class and US taxpayers to this for-profit healthcare machine. Here from another government agency, it's the ASPE.gov. It's Assistant Secretary for Planning and Evaluation. Over here on January 31st, 2024, they reported that Americans pay around 2.78 to 3.2 times as much money for pharmaceutical drugs. And for a country that pays the most for healthcare, we actually have way worse results than most countries. We have the highest administrative costs for any wealthy country, and yet we pay the least for long-term care. The United States has worse healthcare outcomes compared to other wealthy countries in life expectancy. We are the worst in this list. Ranked number 14 at a life expectancy at 78.4 years. Infant mortality, we are the worst. Safety during childbirth, we are the worst. We are overall pretty bad at healthcare here for paying way more money than anybody else. And not only that, but not even all Americans have health insurance. Only 92% of Americans have health insurance, which honestly, it probably equates to around like 30 million people that don't have health insurance. Let me take a look. Let's see here. State of health insurance U.S. coverage. Okay, it says an estimated 26 million Americans, or 8% of the U.S. population, lacked health insurance in 2023. In this article called Key Facts About the Uninsured Population, when we look about why are people uninsured, it says people are uninsured, or many uninsured people cite the high cost of insurance as the main reason they lack coverage. In 2023, 63% of uninsured adults aged 18 to 64 said that they were uninsured because the cost of coverage was too high. Many uninsured people do not have access to coverage through a job, and some people, particularly poor adults in states that have not expanded Medicaid, remain ineligible for financial assistance for coverage. So the cost of insurance is really high, but also the cost of going to the hospital, like in my case, is really high. So it's like damned if you do, damned if you don't. So the reason I started researching this topic was because of that recent government shutdown we had. The Democrats got shut down the government because of apparently healthcare. And so essentially what was going on was that the government was paying additional money so that people can have affordable insurance. People like myself actually that are on government insurance. Now, essentially, the result of that was they didn't get any promises that they were going to continue helping subsidize people's expensive insurance. And so people like myself now, my insurance is going to jump up to around 500 a month. And I consider myself one of the lucky ones. I'm young, I'm able-bodied. If my insurance goes up to $500 a month, I can figure it out. But what if you have like a family? What if you have you, your partner, and two kids? That's four people. Like, if my insurance is $500 a month, what about you if you're covering for four people? You don't know. It can be a lot more just for healthcare. If you're a parent, are you going to risk not having healthcare in case your own child gets sick? Like, I think it's just a much more complex situation, and it's kind of insane to me. And I told you I'm an Uber driver, so I meet people from all around the world, and nobody can really fathom why our system is the way it is because it just doesn't really make any sense. I mean, the only real justification is that it's for the incentive of, you know, profit making. Most other developed countries consider healthcare a human right. But why are we so different here? And it kind of got me thinking. It started to make me realize that so many things in the United States are very divisive. Like, our health insurance isn't just for everybody, it's not like the agenda to have everybody taken care of. You have to pay for insurance through your work. Then you also have to pay insurance via Medicare taxes. And now, what's Medicare taxes? Medicare is insurance for old people. So now you're paying for old people. And then there's also Medicaid taxes. And what are you paying for there? You might be paying for maybe poor people or uninsurable people or whatever. I mean, we're paying for very specific groups rather than just paying for everybody. And I think it kind of creates a structure where everybody is paying their taxes and you might not be getting any benefit from your government. Like most of my life, I kind of felt like government doesn't do anything for me. If I had government health insurance and everybody had government health insurance, it might feel like, okay, at least I know I'm benefiting from the health insurance I'm paying for. At least I have some sort of government benefit. But in America, a lot of people really feel like, what does government do for me? Why do I want to keep on paying taxes in this system that does nothing for me? There's zero service. And in the recent shutdown, the look at it. This is from WhiteHouse.gov. The whole thing they were basically saying is that it says fact: Democrats shut down government over free healthcare for illegals. It's targeting another group of people for what I see as an incredibly broken system. And just to fact check, if I go to healthcare.gov, it says healthcare coverage for immigrants. People in these groups can get coverage through the marketplace if they're eligible. United States citizens, United States nationals, and lawfully present immigrants. Undocumented immigrants can't get marketplace health coverage. They may apply for coverage on behalf of documented individuals. So I suppose there is some sort of way where illegal immigrants can get insurance, but I mean, it very clearly specifies that undocumented immigrants can't get marketplace health coverage. I just feel like if there's always somebody to blame, always some sort of group to blame, old people, poor people, illegal immigrants, whatever, you're not really looking at the real problem, which is the overall structure of the system everything is built upon. This whole entire for-profit healthcare system, I find like that's the issue. I've even heard justifications that our system where we get insurance through our work, whatever, gives us the freedom to choose. Like that allows us to be more free because we get to pick our health insurance coverage. I mean, okay. To me, I would feel a lot more free if I was able to keep this $5,000 a year on health insurance that we pay more than any other country and just like not even have to think about whether I'm covered or not. So in Germany, how they do it is basically if you make less than 73,800 euros a year, you're automatically on the public option. If you earn more than that, you can pick and choose some superior health insurance options that exist if that's what you want. And it's fine. I mean, I think private public options are good, but they don't have an issue where 8% of their population is not covered. None of these countries do. It's just us. I just think that if the incentive was to actually make sure people had health insurance coverage so they don't go bankrupt if they get sick, you would just do something like copy something like what Germany does. Just copy another nation that has a working system. Is it really that hard to implement that in the United States? But once again, it comes down to incentives. I mean, the incentive isn't to keep people from going bankrupt if they get sick. What it is, well, it's to take all the money you got whenever you get sick. Anyways, that's some of my research on American healthcare. I mean, we pay a lot more per person. We pay a lot more for medicine. We just pay a lot more, and it doesn't really seem to net out for better results. Anyways, moving forward, I kind of want to just keep exploring, seeing like the things I feel are a bit off with how things work in America. I'm just noticing that things are really challenging for the average person that lives in this country, and I want to know why. So, anyways, I just want to keep on researching things and taking you on this journey to learn a bit more. Yeah, so talk to you guys soon. Oh, and just to add, I don't really have a very solid worldview on anything. Like, I'm understanding that politics has a part to play with in all of this, but I don't really want to get like political or anything. I'm a numbers guy, and when I see numbers, it helps explain things to me more clearly. So, I'm more looking to do things related to that, just number focused explanations. But yeah, I look forward to doing more research and talk soon.